Hi everyone. Thank you for coming to today's session. Welcome. Um, my name is Kat and I'm an implementation manager at Accurx. So yeah, we're here today to talk about QOF, everyone's favorite topic at this time of year. But yeah, I appreciate we have only just started, so I'll give everyone a few minutes to join. For anyone who has joined already, you might notice that on the invite, we were supposed to be joined by Dr. Dave Trisker, who is a real QOF expert. Unfortunately, he's not available today. So you've just got me. I have been learning a lot from Dave already about QOF and hopefully can do this webinar to at least a version of his standards. He does apologise that he's not able to make it today, and he will be recording something that I will be sending with the webinar recording. And he also, as you might have seen on the invite, we're kind of sharing one of his documents, which has got loads of questionnaires that you can just download already to kind of take some of the work off you. That will still be being shared. It just might be next week rather than straight after this webinar. But yeah, thank you all for coming along. Apologies that it's just me, but hopefully should still be a really good session. And yeah, we've got quite a lot to cover. I do also have, you might see some panelists. I've got two of our support superstars, Samira and Sophie, on hand to ask questions, and then another implementation, oh gosh, I don't know why I started doing alliteration, another implementation superstar, Kate. So they'll be on hand with the Q&A box. So if you do have any questions throughout, please feel free to use that box. They'll be answering everything, and then we will have time at the end for questions as well. And if you do have any specific questions for Dave, I can also pass them on to him and get his answers within the video that he sends through as well. So yeah, if you've got anything, please feel free to shout. Yeah, no question is too small. So definitely make the most of the resource that we've got here. Okay, I might just give everyone a couple more minutes in case anyone's a bit late to join, then we can get started. And I do apologize. I have been going through this quite a lot this morning in preparation for Dave not being here, but I might be looking up at my second screen just for some prompts, so apologies for that. I can see how many have we got. We've got about 400 people. I know quite a few people registered, but I appreciate it's yeah, you're not always able to attend. But yeah, anyone who registered for the session will be sent the recording as well. So even if you do have to drop off at some point, yeah, no problem at all. Or if you know colleagues who were intending to join but aren't able to, yeah, everyone who registered will be sent a copy of the recording, so you don't have to worry about that. And then all the subsequent resources as well. Okay, well, I'll get started. And then, yeah, we can always come back to the recording later. So, yes, for anyone who's just joined, my name's Kat. I'm an implementation manager at Accurx, and I'm here to chat to you about how Accurx can help you as you come to the end of the QOF year. This was created in partnership with Dr. Dave Trisker, who was intending to be on the session, but is not available today. So he sends his apologies, but he has kind of gone through all of this with me. So it's a lot of his wisdom anyway. But the way the session is going to run, so I'll kind of do a quick introduction of things to be thinking about with QOF, and then we'll dive into some of the Accurx tools that you've already kind of got access to through Accurx, so how you can kind of make the most of that technology that already is available for you. I'll be doing a demonstration as well of how, if there is something that you don't have through Accurx, how you can kind of create that yourself, and then send it to a cohort of patients. And then, yeah, at the end, there will be time for questions as well. So I don't need to kind of tell you what QOF is. I'm sure you're all very, very familiar with it. So I just wanted to kind of touch on how you can adapt to the challenges of QOF. So things to be aware of when you are looking at all of the things that you need to kind of tick off for the year. So first of all, it's about looking at, yeah, kind of the attributions for each thing. So with the QOF framework, it's not evenly weighted. Some indicators yield a really large reward for quite a minimal effort. And yeah, you just need to make sure that you can see those areas where the effort is quite minimal and you can still get quite a lot of points to kind of, yeah, make the most of the time that you've got and workload that you've got. Then leveraging technology. So if you're trying to see all of these patients one by one or call them one by one to get this information, it's really time intensive, and yeah, it kind of leaves you open to more errors. So using Accurx, you've got solutions to kind of automate that outreach, get the data really easily, and update the record as well. So rather than that having to be done manually. So we've got, and I'll kind of talk to them in a bit more detail, but we've got our kind of batch messaging, our custom questionnaires, and then booking links as well, which you can use to just really, yeah, kind of automate the whole process for your team. And then finally, we've got empowering patients. So patients are a really big part of QOF. Yeah, empowering them kind of lightens that administration burden and improves their compliance as well. So again, using these kind of tools that you have through Accurx can give them that kind of power themselves. So, you know, they can book into an appointment that suits them. They can complete the questionnaire, and then they can kind of engage with the educational resources as part of that. So making sure that it's not just kind of on the practice, it's also part, you know, up to the patients as well. If we talk to the disparity a bit more, so yeah, not all of QOF is equal, as we've kind of touched on. There are indicators that have, yeah, significantly higher points, and then in turn give you greater financial returns for you know, the same amount of effort as some that have less. So those high value indicators could be things like smoking status, blood pressure control, mental health reviews. So there's a maximum impact for all of those indicators, which, yeah, can be kind of achieved with minimal actions. So yeah, if you prioritize these high yield areas, practices can then achieve quite large QOF gains without having to spread their resources too thinly, especially as you're coming out of yeah, winter and all of the pressures that come with that. Now, looking at the technology that you've got access to, so these are all of the Accurx products that can kind of help contribute to this. If you do find that you don't actually have access to any of these, please reach out to us. Our partnerships team are more than happy to chat through how you can get access to them. But if we start with SMS, so this is the one that most people are kind of most familiar with. This is the kind of one-to-one messaging with patients. So if you are speaking with a patient and you need to follow up with them to get them to book into an appointment or get them to book in a blood test, then you can do that straight away, and you can schedule those messages. You can have templates set up, so it can make getting that follow-up action done really quickly. We've also got our batch messaging, so that's if you're needing to message a large cohort of patients. So yeah, say if you're needing to get ethnicity information from all of your patient population, you can send that with one message going to multiple patients at a time, and then yeah, can kind of reach as many people as needed. You can stagger those messages as well, so they're not all going at the same time, but it means you can capture that information in kind of one action rather than having to think about it constantly. As I've mentioned, we've also got our booking links, so giving patients the autonomy to book into an appointment that suits them, which they're then more likely to attend. With all of our self-booking links, they also include the option of saving the appointment to their calendar, so they can keep better awareness of when their appointment is actually booked for. But equally, we've got our appointment reminders. So when those patients are booked in, they're being reminded of the exact time of their appointment. So again, just trying to make sure those patients who are booking into those appointments actually attend. And with the appointment reminders, patients can also cancel their appointment if they're no longer able to attend, then freeing that appointment up for someone else who needs it. And then finally, we've got our questionnaires and patient triage, although patient triage is maybe less relevant for QOF. But with our questionnaires, we have some that have been created already by Accurx that are available to anyone who has our questionnaire product. You do also, with that, have the option of creating your own questionnaire. So if there is any information that you find is missing from the questionnaires that are already created, or if you want to merge some, or you just want to create something specific to your patient cohorts, then you can do that quite easily as well. So in terms of areas to focus on, these are some that Dave picked specifically that, as I kind of said, are kind of the high yielding areas with minimal effort. So there were 3 key factors that Dave used to pick them. So potential yield in terms of QOF points, the ease of completing the necessary actions, and then also the size of the patient cohort involved. So I'll kind of go into them in a bit more detail, but the high yield indicators like smoking status and diabetes management offer substantial rewards for management effort. And then there's smaller patient groups where for things like COPD or mental health reviews, which allow for quite targeted follow-ups where necessary. It makes them efficient to address even when those manual interventions are required. So focusing on these areas means that practices can optimize their workflows while ensuring they meet those critical targets. So to start off, we've got our smoking status and support. So the indicators are SMOK002, SMOK004, and SMOK005. So those are the smoking status and support indicators. And in total, it's 62 points. So for all 3 indicators, you can get a total of 62 points for the kind of QOF year. And that kind of contributes to why it's a quick win. So it's a high impact indicator with a substantial contribution to QOF earnings. And there are kind of tools that you can use to just make sure this is kind of a one action completion. So we've got a smoking status questionnaire. I have linked the questionnaire help pages within this slideshow, but I have also got them here, so you can access all of these from our Accurx support center. But it updates the records, so confirms whether the patient is a non-smoker, ex-smoker, and then if they are a smoker, it signposts them to smoking cessation services, and every question that they complete will have SNOMED codes assigned to them as well. So rather than having to manually add that information in to the patient's record once you've got it, that all happens automatically when the patient completes that questionnaire. And then ensure appropriate coding for completed interventions. So that's just something to bear in mind on the follow-up of having that information come through. Next up, we've got diabetes. So the indicators are DM020, DM021, and DM033. So for these ones, there's 37 points combined. And it's a quick win because it offers a high point value with a streamlined and focused approach. So again, minimal messaging needed, minimal actions needed, and you can get that kind of large cohort of patients attributed to. So again, we've got our batch messaging. So if you're wanting to get these patients booked in for their blood test, you can just send them a self-booking link to get them to book in. And again, you can use that batch messaging, so you can send that to all patients at once and get them all to book in to those appointments. And then we've also got the diabetes pre-appointment questionnaire, which you can send to patients before their review to get up-to-date information from them. And again, we've got those SNOMED codes assigned to that questionnaire, so that all gets saved directly into the patient's record. So when they do attend the appointment, you've got all of that information in front of you straight away. Next up, we've got mental health reviews. So the indicators is quite a lot of them. So it's MH002 all the way through to MH021. So various mental health indicators within that, including care planning and physical health checks. It's 34 points combined. And it's a quick win because focuses on a small number of high yield patients who can significantly improve the patient practice performance. They are a vulnerable group of people where the interventions can make a substantial impact on their health outcomes. So it's a really important one to do. And in terms of actions, so this is one where you might want to create a custom questionnaire to capture all of the required review elements. We do have some questionnaires for, mental health kind of assessments, but yeah, it can be helpful to just have one questionnaire that you've set up for everything. And then once you've got that set up, it's using Accurx to send that message to those patients, update their records, and then schedule those physical appointments with using the self-book functionality once you've received that information from the patients. Just got a couple left. So we've got the coronary heart disease blood pressure control. So this is the indicator CHD015. It's 15 points and it's a quick win because patients with no blood pressure reading in the current QOF year, but a previous normal blood pressure mean a high success rate. And then when patients are completing their own blood pressure readings rather than having to come into the practice to do them, then that makes it easier for the practice to get that information coded into their record. So again, we have a questionnaire set up already, which is the blood pressure reading questionnaire, which can be sent to patients so that they can just complete their blood pressure reading at home. And then that would be coded again into the patient's record. Finally, we've got the COPD indicators combined. So we've got COPD 010, which is a complete COPD review, and COPD 014, which is the referral for pulmonary rehab. It's 11 points combined, and it's a quick win because it's a small manageable patient cohort with remote completion possible. And it allows proactive coding of declined rehabilitation offers to meet targets. In terms of actions, we have a COPD review questionnaire already set up. So again, that's linked here and showing in the tab there, which again will have SNOMED codes assigned to it, which would go code back to the patient's record. But you can also offer the pulmonary rehabilitation referral. Gosh, I'm really struggling with that one, through Accurx while enabling patients to code a decline via the questionnaire. And that's something that, again, you can create using the custom questionnaire tool. And what I will be doing in the demonstration is showing you how to do that. So I'll just get into it. So what I'm going to do is show you how to create your own custom questionnaire, and then how you can send it to a large cohort of patients. I'm using EMIS today, but please don't worry, it works exactly the same regardless of what clinical system you're using. So we won't be on the screen for very long. You just do have to be kind of logged into your Accurx toolbar in order to access this. Now I've got my toolbar here. Oops. looking up questionnaires already. If you're wanting to create your own questionnaires, you can do that just by clicking on your initials on the toolbar and coming down to the Manage Organization screen. So this is where you can access a lot of your different features. So if you're wanting to create templates, wanting to set up batch messages, or check in on your patient triage settings, or look at any of your dashboards, it can all be done from this Manage Organization screen. If you select questionnaires, this is where you can see any questionnaires that have been created by someone in your practice or workspace. So you'll see all of the drafted questionnaires sitting at the top here. You can see in the Accurx demo environment, we've got quite a few being drafted, and then any published questionnaires will sit at the bottom of the list. Now, because I am not as familiar with this as Dr. Dave Trisker is, I have created the questionnaire already here. So I'll show you the specific questions in a second. But if you are just wanting to create one straight away, it's just clicking this blue button here, Create Questionnaire, and that will take you to, I guess, the first step, which is coming up with a name for it. So this questionnaire I have called the Pulmonary Rehabilitation Questionnaire. If you have created a questionnaire or you've started creating a questionnaire, it will stay in this list and you can always go back and edit it just using the pencil on the side here. So first of all, there is the questionnaire name. So yeah, I've given it the very astute name. When you are creating questionnaires, you've got the option of adding questions. So this first question is a multiple choice question with just a single answer. So that means the patient can only select one thing from the list. And the first question was about breathlessness. When you are creating these questions, you've got the option of selecting whether you want the patient to be able to select multiple at once or just one. And with each answer, you can add a SNOMED code so that if the patient selects that answer, a SNOMED code is automatically assigned to that patient's record. You do also have the option of adding a description if you think it would be helpful. It won't be saved to the patient's record, but it might just give them a bit of extra context if you think, yeah, that would be necessary. You can add as many options as well. So I've only got 2 options here, but I can just keep adding more if I need to. And I can also remove any that I don't think are suitable anymore. And then it's literally just clicking save. This next question has multiple answers. So you can see here, it's how would you describe your current level of activity? I've selected the many answers option, and that means patients can just select as many of these as are applicable. And again, I could add a SNOMED code to one or all of them if I needed to. Going through the list, we've got some more, yeah, kind of one answer questions or many answer questions. This final question is a free text question. So if you want to just get information from the patient in their own words, then you can just have a free text option. And it won't have a SNOMED code assigned to it specifically because it won't be based on whatever the patient selects. But it can be quite helpful to get that qualitative information. If I just show you how you kind of create the question as well. So when you first select add a question, these options will come up. So whether you want to have a multiple choice question, a measurement question, or a free text. If you're selecting multiple choice, then it is just deciding, oops. Sorry about that. It is just deciding what the question should be, whether they want to be answering one or multiple, and then what those answers are. If you're wanting to just add in a question for what someone's height or weight is, then those are already kind of created for you. So you just click on this measurement section and just select whether it's height or weight that you want to add. If I add that, it will have a SNOMED code assigned to it already. And then I can just send that so the patient would be able to enter their height when they answer that question. And if you need to remove any questions, you can do that just by clicking remove. If I'm happy with all of these questions, so we've got this one as a SNOMED code assigned to it. So if this patient declines to attend the pulmonary rehabilitation program, then that will be coded against their record as having them declined pulmonary rehabilitation. But again, if there are other instances where you think it would be helpful to have a SNOMED code assigned, then you can do that. The next stage is creating the invite message. So this is just whatever text is shown when the patient actually receives the message with the link for the questionnaire. Again, we've got a SNOMED code here. So that basically means when the patient receives the message, there is a SNOMED code assigned to it. So that rehabilitation being offered will be coded against the patient's record once they've received this message. And this is just a template, so it will just show up when whoever is sending the message will kind of selects this questionnaire, but you can change it and you can kind of add as much information or context as you'd like. You'll also be able to see here a fragment counter. So this will show you what the number of characters are and how many fragments this questionnaire will use. We take into consideration the patient name and the kind of sign off from the practice, as well as the link for the questionnaire. So it should be kind of the maximum amount of characters that message will fill. Then the final section is kind of creating that confirmation page. So again, it will give the patient any extra context. You can change this message if you'd like to, of what the kind of next steps should be or what they should expect after this questionnaire. And you can add a SNOMED code for when they've completed the questionnaire as well. So if you'd like to have a code that signifies that they have, given that information, then that code would be assigned to the patient's record once they have completed it. Oh, I lied. This is the final stage, which is making sure that you've got one place where all of the responses to that questionnaire will go to. So within your Accurx inbox, you will have some folders set up. Some of them will pull through under the team section, which would be based off roles within your practice. So things like admin, doctors, nursing, that kind of thing. You do also, with the Accurx created questionnaires, they already have folders assigned to them. So any questionnaires sent would go to those folders. So if we look down at the ethnicity as an example, with these custom questionnaires, because they don't have a folder specifically assigned to them, you just need to make sure that you select a folder that they should go into. And this just means, I guess, whoever needs to be looking at those responses as they come through. So admin is usually quite a good one, but you might have some others that kind of suit your practice best. And then if I click save and done, I've got the option of publishing it straight away or saving it for testing. Now, if you save it for testing, you can still send it to patients, but they have to be test patients. So you wouldn't be able to send it to any real patients. If you're publishing it, then that means you're happy for it to be sent to any patients. In the interest of showing you the kind of batch messaging side as well, I will publish this. And now, so we have the drafted questionnaire section at the top. It will now move to the very far away published questionnaires section. Now, when you've published a questionnaire, the other thing you can do is share it. So this is what Dave Trisker will kindly be doing for all of you who've registered for this session. He will have some links to send you of questionnaires that you can just download straight away. But if you have created any yourself that you think other practices within your PCN or other practices you kind of work with would really benefit from having, rather than having to create their own, then it's just clicking this share button. It will generate a link which you can just send to whoever you want to download this questionnaire. Or if you work across multiple practices, then you can just download them into the other workspaces you work against. And same if you receive a link, it's just kind of pasting it into your search bar when you're logged into Accurx, and then you can download them into your workspace. So if we're now wanting to send this to a large cohort of patients, the next thing to do is to access the batch messaging section. So with batch messaging, it's sending a message to a large cohort. You'll be able to see any that have been sent already in this list. So you can see any that are scheduled, any that are in the process of being sent, and then any that have been completed as well. If you're wanting to start your own batch message, it's just clicking the blue button. And at this point, you can confirm what kind of message you'd like to send. So there's 3 different batch messages you can send. There's a self-booking link. So that's inviting a large cohort of patients to book into an appointment. A message, which just gives either some extra context, or if you wanted to send kind of patient information, or let patients know about a service that has just started up in the area, anything like that, then you can select that one. And then we've got the flurry, which is our questionnaires. Now with these messages and flurries, they get sent through the NHS app in the kind of first instance. So any patients who have the NHS app downloaded and notifications switched on, they will receive those messages within the app as kind of the first instance. With any kind of patient details as well, if you've got email addresses for patients, we can then also send it via email. So I'll talk more about that when I've got the CSV file. But yeah, in this instance, we're wanting to send a questionnaire, so I can just select questionnaire. If I click on this select a flurry, I will have all of the questionnaires that have been created by my practice and also by Accurx listed here. You can just kind of scroll through and the Accurx ones will be sitting further down and kind of categorized. But if I just search for the pulmonary rehabilitation questionnaire, so it has included the template that I already used. I can type anything extra in there if I'd like. And then I've got the option of saving that message to the patient's record. So that would just save the actual text of the message into the patient's record. If you'd like to have that saved against individual patients, then you're more than welcome to just leave that box ticked. A lot of practices tend to want to have the messages not saved, so you can just untick that box, and that means you won't have this saved within the consultation notes. Now, because that questionnaire was set up with a response group kind of allocated, that is what we'll show here. If when I go to send this questionnaire, I think actually it would be better off to come back into the nursing team or the asthma team or doctors, then I can just select those here. So admin will always be the default, but I can always change that as well. Also worth bearing in mind, if you opt to not save the message to the patient's record, that SNOMED code will still be assigned. So you don't then lose that coding if you don't have the actual context of the message saved. The next step is uploading the list of patients. So all you need to make sure is that you've kind of pulled a CSV file that has patient's NHS number, date of birth, and then either at least the kind of email or mobile number, so that then it can be contacted. Any patients who've opted out of SMS or email notifications should not be included. And if you do need some help of how to create that list of patients, we've got some more information here. I believe I've got a CSV file ready, so we can just, I know it doesn't quite fit, but we can just use that list anyway. So when you upload a list of patients, you'll immediately get this preview. So you can see the total number of patients who have been included in the list, how many of them can be contacted and how many of them can't be contacted. If you use this see details, you can see exact information. So these 2 patients have an email, the rest have mobile numbers. And then with this cannot be contacted, you'll be able to see as well, they do not have UK phone numbers or email addresses listed within the file, so they aren't able to be contacted. If you want to hear more or read more information about that, you can always access our support centre as well. But if you have quite a large number of patients here who cannot be contacted, you can download that list. It would be worth removing this list completely and then removing those patients from the list. The thing about when you're sending a message to a large cohort of patients is if there are numbers that can't be reached, then you might still be charged for the cost of that message, even though that patient can't actually be contacted. So if you do need to remove the list, you can just click remove, and that kind of wipes it. But if I continue, the next thing I can do is choose when I want to send the message. So you might be getting ahead of your admin time, and you might want to kind of send this at a time, 10 o'clock tomorrow morning or something, so that the reception team have time to kind of access, answer any questions that patients might have. So you could just choose a date and time. You could also, if you're getting really ahead, schedule it for, say, next week, whatever kind of suits the scenario. Or you could just select that you're happy for it to go now. If you've got a large cohort of patients, then you can also stagger the sending of the messages. So if you've got, thousands of patients who are all going to be sent this message, you might not want them all to receive it at the same time. So you can use the staggered sending. All you need to do is select how many days you'd like the staggering to be across. Because this is, again, quite a small list, I can't really stagger it too much, but I could stagger it to have one patient a day over the next 7 working days, if that's what my preference would be, to then kind of reduce that inbound volume from patients. But if I just leave it for now, now I get to review the message, so I'll be able to see everything that I've already selected. I can always go back and change it if I need to. But if I'm happy to just send that, then now that message has been sent, and it will update in the table here. Here we go. So you can see it here. If you need to kind of see any more information about it, so you want to see how many have kind of been sent already, then you can see that within this details section. If you are sending a booking link, so you're trying to get patients to book into an appointment, then you can see how many have kind of booked off the back of the message that's been sent. And you can also see kind of when it was staggered. You can see all the information about whether you staggered the messages or not. And then also, if there are any that failed to save to the patient's record. You can also see any patients without a valid number, any that failed to deliver, and then how many were delivered. And each of these numbers attributes to a list that you can download. So yeah, you can just click that and you'll be able to see patient details of exactly who that is that you then need to follow up with. That is batch messaging in a nutshell. So let me go back to slides. And we might finish a bit early. Again, Dave probably would have had a bit more to say, so I'm sorry about that. But just as a recap, wanted to run through some principles of success. So as we've mentioned a few times now, prioritize those high yield areas. So really make sure that you are spending more time and energy on the indicators with a high point value, manageable cohorts, and that kind of low level of admin that needs to be completed. Use that data to identify any gaps and target patients efficiently. So making sure that you are seeing how many of your patients need to be contacted, how many have been contacted as part of the kind of day-to-day anyway, and just making sure that you are targeting the patients that you really need to be targeting. Simplify patient engagement. So tailor communication to specific needs. Whether you're sending an SMS reminder or a questionnaire, make sure that it's really clear for patients the request or the action that they need to take, and make sure that it kind of relates to them and their condition. Using the self-booking option as well increases the flexibility for patients. So rather than them just being booked in at a time that they maybe can't attend and then having to call the practice to rebook into a time that they can attend, or them just not turning up to the appointment, offer them that flexibility so they can select when they are actually available, and book in themselves using the self-booking links. Automate wherever possible. So with Accurx, you've got a lot of features that can reduce that administrative burden. So sending a batch message to your large cohort of patients, we've got templates set up that you're welcome to use. And then with those SNOMED codes being assigned directly to the patient's record, it just streamlines your workflows and frees up some time that can be used on many, many other things. And then got monitor and adjust. So regularly review the performance data to ensure you are progressing towards those QOF targets. Appreciate that this time of year is a time where you're just trying to get everything through, as you've only got a couple of months, but yeah, kind of keeping on top of it throughout the year, making sure that you've got these things set up. So yeah, when the next kind of QOF year comes around, you've got everything kind of in place already. And yeah, adapt your strategies. So making sure that you're addressing those gaps that you might have and optimizing the outcomes for your practice, but also for patients. Sorry, this is a really early finish. But if you do have any questions, you're more than welcome to reach out to our customer success team. So that's customer.success@accurx.com. And you can also chat to our support team throughout the day using our live chat. And if you are on any of our support articles, it's just using this button here. So yeah, they've got loads of knowledge and on hand to just help you kind of get that batch message sent or get that questionnaire created. But I don't know if there were any kind of questions left. I can just have a look here. So there's a question here, aren't COPD pulmonary rehab referrals income protected this year? That is something that I can follow up with Dr. Dave Trisker about, because he, yeah, kind of informed me about which one to create. So I will follow up with him and I can let you know in the follow-up email. And then in terms of the other question about receiving an email with the content, yes, I will be sending you an email possibly tomorrow so that I've got time to get that information from Dave. But I'll be sending you the slides and the recording, and then, yeah, kind of all the information and some information from Dave as well. So, yeah. I appreciate you all coming along. Sorry, it's not been exactly what you were maybe expecting. Sorry, I was hopefully did an okay job at covering Dave's topics, but definitely we'll make sure that you're sent some follow-up information to make the most of Accurx features and yeah, get through QOF for this year. But yeah, thank you all so much for coming along. And yeah, I look forward to seeing all this. Yeah, sorry, I'm just seeing questions come through. Yes, I will yeah, make sure that we've got a list of all of the templates that we've got available as well. But yeah, thank you all so much. Enjoy the rest of your Thursdays, and yeah, you can always reach out to us if you need anything else. Thanks.